Pathogenesis of Syngamus trachea infection or Syngamiasis. In trachea, the adult parasite attach themselves and suck blood. There will be tracheitis. It is hemorrhagic or catarrhal tracheitis. So, due to the blood, mucus, and other inflammatory exudates, there will be occlusion of the air passage. As a result, bird will suffer from difficulty in breathing. So, due to severe difficulty in breathing, birds may die. Occlusion of the air passage may also contributed by rapidly growing larvae, adults in the lungs. Ecchymosis, edema, and pneumonia are resulted due to heavy migration of these larval stages throughout the lungs. So all these things will lead to respiratory distress. In severe cases, birds have died. And the male parasite will contribute to the development of minute nodule formation in the wall of the trachea due to its permanent attachment with the organs.